Welcome to Keynotes from Cornell University. Today we'll be discussing fatphobia as a form of structural oppression, how it operates, and how we can combat it. You can join the conversation by submitting questions in the chat. Joining us in studio is Kate Manne, our associate professor at the Sage School of Philosophy at Cornell. Kate, thank you so much for being here.
Thanks so much for having me, Amanda. It's a thrill.
I'm very excited. We're here to talk about your newest book, your latest book, Unshrinking, which was just released yesterday, right, from Penguin Random House.
Right.
Congratulations.
Thank you.
Before we get into Unshrinking proper, I was thinking that it might be helpful for our audience to situate your book a little bit more. So while they're getting ready to do that, let's share the cover of Unshrinking and also a QR code so the audience can take a look, take a peek at it on the publisher's website as we're having the conversation. And so to situate Unshrinking kind of within your work, for those people who aren't familiar with your previous two works, your first book, Down Girl, which focused on the logic of misogyny, became quite popular with scholars and also with people who are not specialists, right? Your second book, Untitled, picked up on similar questions and themes, speaking about male privilege and how that affects women. And then for those listeners who aren't familiar, could you tell us a little bit about how the main concerns of those two books are distinct from Unshrinking and how Unshrinking compares or differs?
Yeah, absolutely. So I've been interested in the topic of misogyny for a good 8 years now, and it kind of grew out of my own background. I was one of 3 girls at an all-boys school the year it integrated, and I faced a lot of misogyny and fatphobia as a then merely somewhat chubby girl, but still one whose size made me the target of a lot of bullying and belittling. So when I published 2 books on misogyny, where I argued that misogyny is something that girls and women face, it's a system that serves to police and enforce gendered norms and expectations by visiting women with hostile treatment. So I made that argument in these 2 books, and a lot of people asked me, well, how did you get interested in the topic of misogyny? And the truth is that I really couldn't tell that story without also telling a story about fatphobia, because when I was a schoolgirl, I was really the target of enormous amounts of bullying and teasing and weight-based belittling that I think point to a larger social phenomenon. I don't think that we can fully face misogyny without also facing fatphobia, and that's what I try to do in this latest book, to really examine fatphobia as a form of oppression that intersects with others, that intersects with racism, with classism, with ableism, with transphobia, and with misogyny.
I was struck by how personal Unshrinking was and how much it draws on your own experience. In the actual writing of it, what made you decide to write the book from that more personal experience?
Yeah, that's a good question, because part of the book, of course, is really an empirical argument that there's not a lot of good evidence that people can reduce their weight through diet and exercise in a healthy way. So a lot of what I'm drawing on in the book is endless empirical studies that show the same thing, which is that people can lose a moderate amount of weight in the short term, but then the weight comes back pretty inexorably over a 4 to 5 year period. So I wanted to say that, but I think the personal aspect of it really makes vivid that this has certainly been my experience, and I am the rule, not the exception. So when I give my own experience that I think vivifies the way that diet culture really fails us and that we're not failing our diets, it's that they're failing us, I hope that it makes vivid to the reader that I'm someone who's tried really every diet under the sun to try to shrink myself, and that in addition to it not working, I think it's a bit surprising to some readers that even as a card-carrying feminist who's now written 2 books on misogyny, I am by no means immune from the dictates of diet culture. In fact, I've been really influenced by this toxic and harmful sense that we need to shrink ourselves or else, in ways that I hope that this is a basis for really finding solidarity with one another in our struggles with body image in general and fat phobia in particular. So yeah, that personal piece of it felt like an important way of putting myself out there and also releasing myself from some of the body shame that has dogged me. Because one of the things about shame that I think is really interesting as a philosopher is that shame kind of isolates us from one another. Think about the characteristic posture of shame, so head bowed, eyes lowered, wanting to disappear. That's a really powerful barrier to solidarity because we're not meeting each other's gaze, almost literally. So telling my story in a way that was unashamed felt like a way of inviting my reader into a conversation that would get us beyond this place of shame and shrinking and really towards a place of solidarity with all of us who have to navigate a fat-phobic world in our vulnerable human bodies.
Well, and I, as a reader, I really appreciated that too, and I could feel that that personal experience doing that work. So thank you.
Thank you.
Despite, or maybe because the fact that this was so personal for you, even though it was so personal for you, you still write with a great deal of humor in the book. I did find myself laughing at parts just because of your tone, right? So not that you're necessarily cracking jokes left and right, but there is some humor there. So I was wondering if you could speak a little bit to that, if there were, maybe that's just part of your style, like your writing voice, or if there was anything about humor that made this topic easier to deal with, or that you found humor in the writing process going through it. I'm just curious.
Yeah, it's such a good question because I think as people who live in larger bodies, we're so often the butt of jokes. And so subverting that felt important to the overall exercise. And I should say, for those who are in the audience, I'm someone who has been much heavier than I am now. So I'm someone who now identifies in the parlance of fat activists as a small fat person. So I want to be clear that I also draw in the book in ways that I think of as really important on the voices of people who are larger than me and therefore face yet more acute forms of fat phobia. But that being said, yeah, fat people, we're so often the butt of jokes, we're so often laughed at, that being a little bit wry and dry about some of the, in particular, thin splaining that occurs to us felt kind of important and apt. So for those of you who don't know the term, mansplaining is a kind of tongue-in-cheek term for what happens when a man who is less expert than a woman proceeds to explain something to her in a self-important way, assuming this false authority that he knows all there is to be said about the topic. For example, I can't tell you the number of times as a moral philosopher that I've been privy to the ethical theories of a man on an airplane or something who assumes he knows all there is to say about the topic and isn't really listening to what I might have to offer, but is rather proceeding to explain an area of expertise. And I think fat people face something really similar, and it's actually quite funny that there is very few, if any, fat person who hasn't done a great deal to try to reduce their body size. So the idea that telling a fat person, well, have you tried diet and exercise? It's just funny because what am I, a fat rock-sheltered Martian who has never been in the world and who really needs this explained to me? And yeah, it's worth saying too that part of the reclaiming effort to be unashamed is with humor, and part of the reclaiming effort is with a term that some in the audience may be uncomfortable with. So it's worth noting that I use the term fat as a completely neutral description now of some bodies, much like terms such as short and tall. Fat and thin merely describe different bodies. I view it as something where, again, we're reclaiming the term in the tradition of fat activism and holding this to be something that we don't need to be ashamed about. Our bodies simply come in rather different shapes and sizes, and that we can own that and be comfortable with that in a way that doesn't require a kind of euphemism like curvy or fluffy, or a medicalizing, stigmatizing term like obesity. So that's why I'm using that term. And yeah, it's connected with the fact that I did want to a little bit make fun of thin splainers in this book.
Thank you for that, because I was wondering, in the book, you're very explicit about your terminology and the vocabulary you use, and unshrinking is part of that. So I was hoping you could kind of walk us through how you got to the term unshrinking for the title, and then also if we could, we'll talk more about fatphobia as a term also.
Wonderful.
Yeah.
So I love process questions, and this is a question partly about process because my amazing editorial team and I must have gone through about 100 possible titles for this book. We brainstormed endlessly. It did not come easily. And I always find that I have the decent ideas that I have, such as they are, in a particular circumstance, which is when I'm going to sleep. So I was just taking a nap with my now 4-year-old daughter one day, and it popped into my head that, of course, the title to this book had to be Unshrinking, which sends the message that we can embrace our bodies and be unashamed and unshrinking in the world and take up space unapologetically, but also capturing the way that I had been previously shrinking from public scrutiny. So I'm someone who cares deeply about systems of oppression and their intersection, and I've been particularly focused, as we got into, on the ways misogyny really makes life terrible for girls and women in many different sets of circumstances. And yet when I had the chance to publicize that work and to talk about an issue that matters to me more than almost anything, I really shrunk from public scrutiny and refused to do TV appearances. I think this is the first time I've been in a situation where I'm on camera and I'm not controlling the camera angle. So this is actually a big step for me, and it feels like a good moment to be unshrinking in this culture that tells girls and women to be small, meek, and quiet.
And we are so happy that you're here and doing it and sharing this with us. Yeah, the image of unshrinking, I know you talk about it in the book too, so I mean, that makes sense. Falling asleep, though, it's a bad time to get ideas.
I will say that, having a quick way of recording your thoughts when you have those sort of little brain waves is nice. But it's to say, in terms of process, I'm a big fan of letting your brain wander, and sometimes you come up with solutions to intellectual problems when you're actually at your most relaxed. So that is my, I think, only process insight, if it can be called that, is sometimes it's when we're not trying to solve an intellectual problem that we have that little moment of seeing what the title of it had to be, and then it felt inevitable that it would be called Unshrinking.
Yeah, that's a really good tip for I was going to say all the scholars in the audience, but actually for everybody who's solving big problems.
We're all problem solving all the time.
So I wanted to ask you a little bit more about the topic of the book, fatphobia. Specifically, why the term fatphobia, and relatedly, why did you feel that it was important to not only name it, but also to expand upon it in a book?
Yeah. So this is actually a controversial choice that I've made. And some scholars working in this space, like Aubrey Gordon, for example, whose work I just revere, prefer the term anti-fat bias, which I also think is an excellent term for what we're getting at here. One reason that I like fatphobia is that it gets at a parallel with certain forms of oppression that I think liberals and leftists do tend to take appropriately seriously, like homophobia and transphobia. So fatphobia felt like it could establish a useful parallel with those forms of oppression. And while I would never say that fatphobia is the last acceptable form of bigotry, because there's never, unfortunately, a last acceptable form of bigotry as we're seeing so vividly in the world currently, I think there is a sense in which people in my, broadly speaking, political left ilk, they tend to be a bit complacent about the topic of fatphobia. So establishing this parallel with transphobia and homophobia felt helpful to me. Now, of course, there's always a risk of the term, which is why Gordon is worried about it, that will make it sound like it's something like an actual psychological phobia that's a disproportionate fear of fat people, which is, of course, not what it is. But I think we're accustomed to thinking of phobias as also applying to these systematic forms of oppression where it's what people face, not what people feel. So that's very much how I define fatphobia, is a system of oppression where fat people face unwarranted judgments about our bodies, assumptions about our health status that may or may not be accurate, but also forms of moral, intellectual, and aesthetic bias that really deserve to be called out and disentangled. So part of what made it for me a ripe subject for a book-length exploration is I felt like it was helpful to draw out those different strands and really go in as a philosopher to say, fat people are often seen as morally blameworthy. Is that accurate? Or can we debunk that myth? And I think the argument that I made, hopefully successfully, is that that's really not a fair way to look at fat people's bodies because for, among other things, fat people's weight is not really under our tight long-term control. Moreover, to the extent that fatness is a health risk, and that's itself complex and controversial, thin people take all sorts of health risks all the time and are not subject to shaming and judgment on that basis. So there's a lot of moral condemnation of fat people that feels to me to be singling out a class of bodies for derision and contempt based more on aesthetic disgust than anything. And that gave rise to another chapter of the book, which is the aesthetic piece of it, the way sexual fat phobia operates, and I think is particularly harmful to girls and women, as well as non-binary people. So there's often, again, a myth that felt worth debunking here, that fat people simply aren't regarded as sexually attractive. But I think that, not to put too fine a point on it, porn consumption belies that idea because fat bodies are a very common search term in pornography. So one way of looking at it is that fat women are often sexually desired but seen as having low status that mean that they're perhaps subject to forms of treatment that mean they have these sexual relationships that are private and are not regarded as someone who can be dated openly without shame. So that's like a really sad but prevalent aspect of fat phobia, where it's not that certain bodies are inherently undesirable, it's that they're not seen as having a sufficient status. And then finally, there's the intellectual piece of fat phobia that I really wanted to get into as a moral philosopher, because I'm someone who has so often been subject to assumptions that I think befall many women in philosophy. So for those in the audience who don't know, philosophy is the most white male-dominated discipline in the academy, in the humanities, and is on a par, I should say, with things like so-called pure math and physics. But because of that, women are often assumed not to be philosophers, but I think fat women, it's a particularly prevalent assumption. I mean, just to give you one small anecdote, I was giving a convocation talk at a university where I was chatting casually with an audience member beforehand, and I introduced myself to him as Kate. He had come to hear Kate Manne give a talk, and he assumed that I was an audience member and not the guest speaker, even though I was all dressed up and ready to go and fairly clearly in professional mode, because I think partly of the size of my body was seen as so incompatible with intellectual authority. So often we just make assumptions that philosophers in particular and intellectuals generally have to be lean, non-disabled, cis white men, and wealthy ones too. And so I wanted to get into that and really look at the amazing talent that we might be missing out on because we're not listening to people who happen to be in larger bodies as intellectual authorities, regardless of what they might have to say and what insights they might have to offer.
It does sound like this topic gives you a lot to work with also. So on that, I wanted to get into the book a little bit more. You have this wonderful close reading of a 1938 play called Gaslight in one of the chapters, and you use it to tease out some of the logic behind what we know as gaslighting today, mainly that it is, as you describe, a systematic process that works to make us feel defective in some way for the beliefs, thoughts, feelings, desires, and appetites to which we are in reality entitled. You say that gaslighting attacks a person's mental freedom, her capacity for independent thought. So this really struck me. I hadn't heard about this play before, but your phrasing of it also. So I was curious, why was the concept of gaslighting important for the work?
Yeah, so I'm so glad you called attention to that, because I'm someone who has studied gaslighting in the context of misogyny for a long time, because I think that a really powerful tool of misogyny is gaslighting women to feel either guilty and ashamed or crazy and irrational for mental states like beliefs to which we're perfectly entitled in reality. And one of the observations that has been made by several scholars working in this space, including Elena Ruiz, who's an amazing philosopher, is that gaslighting can also be cultural. So in her view, there is a kind of gaslighting of people of color by white supremacist forces in Anglo-American culture to make people feel like they can't complain about mistreatment in ways that is really pernicious. So my theory in this book is that another cultural force that gaslights us is diet culture. So I look and try to establish, just as you so nicely put it, a close reading of the play Gaslight, the original Patrick Hamilton play, which is in a way subtler than either film. I mean, the film, both the UK and the US version, are wonderful, but the play really establishes this interesting piece of it, which is that by making us feel ashamed of our behavior or our bodies, you can gaslight someone into not asserting her truth. And in my case, the sense that the next diet would work, this next time will be different, I'm really to blame for not having the thin body that is designated to be the one that is appropriate and desirable according to dominant patriarchal standards. That feels like an exercise in gaslighting, which also undermines something that I've come to think of as so important, which is self-trust. So the practice, the well-evidenced practice of intuitive eating, I think can be seen as pushing back against diet culture by saying we can actually learn to trust our own bodies and our own hunger and satiety or fullness cues. And it's a way of saying the fact that gaslighting has severed this cord of trust that should run between us and our appetites, that's something that we can and should combat, but it involves a lot of hard work to get beyond that gaslighting that makes us feel defective simply for having an appetite, simply for being hungry, and simply for liking tasty foods, which I think it's a normal and healthy and indeed really good part of life that we have an appetite for something that can be a deep human pleasure and source of nourishment for our bodies.
I really appreciate you bringing attention to this concept also in this context. And so we actually have an audience question that I think dovetails really nicely from Emily.
Great.
And she says, I'm curious how you see fatphobia as intersecting with eating disorders where fear of changes to weight or shape may dominate behavioral choices.
Yeah, that's such a great question. And I think that this has been something that we've seen a new discourse springing up around the concept of food noise recently. And I wrote about this for the New York Times a few weeks ago, where we're seeing people really feel that their own appetite and hunger and cravings are just verboten, forbidden, and they're categorizing them not as their inner voice of hunger, but as purely something that is noise that ought not be listened to. And I'm completely sympathetic with anyone who is in that space right now. I've absolutely been there myself. But my view of it and what I've found when I've spoken to weight-neutral dietitians and clinicians and psychologists and so on is that if we let go of our internalized fat phobia and have the idea that our bodies are actually allowed to be the size that they end up when we eat in ways that are nourishing and involve listening to our hunger and satiety cues. If we let go of that, a lot of the disordered behaviors and risk factors for eating disorders tend to reduce quite a lot. And I can talk to my own experience here. For me, fat phobia and the internalization of it as a fat woman is directly responsible for my falling into disordered eating patterns. And I was someone who had been on so many diets and was so frustrated by their becoming progressively more ineffective that I simply stopped eating for days at a time because I just couldn't do it anymore. I couldn't follow another diet strictly and have it fail or perceive myself as a failure. And so that led to me developing patterns of just severe fasting and disordered eating that I think is, not only harmful in my particular case, but is a reflection of the statistic that dieting, which is often a response to these fat-phobic beauty norms, places people at about a 5-fold risk of an eating disorder, a full-blown eating disorder. So I think the connection is really tight. It's not to say that every eating disorder can be explained by this mechanism, but I think that, put it this way, if we saw an end to fat phobia, we would see a huge reduction in disordered eating and even full-blown eating disorders. And the final piece of the picture is the parenting piece of it. We know that the biggest risk factor for girls developing an eating disorder is being perceived as overweight by her parents. And the other one is being put on a diet. So that suggests that the connection, while not one-to-one, is a really tight connection, and that parents who, perhaps well-meaningly, oftentimes with the best of intentions, do try to control their children's weight, really do place them at a higher risk for something which is demonstrably unhealthy, namely disordered eating, or again, full-blown eating disorders that have, after all, one of the highest mortality rates of any mental illness, at least when it comes to anorexia.
Wow. That actually answers or kind of gets to another audience question we have from Andrea about specifically parenting and suggestions for preventing children from developing kind of that internalized fat phobia.
Yeah.
And so you spoke about it just now a little bit about parents not maybe are there other suggestions that you might have as a parent yourself also? I know you've mentioned before.
Yes. Well, I love that question, Andrea. One book that I think is really brilliant on this topic is my friend Virginia Soule-Smith's book, Fat Talk, Parenting in the Age of Diet Culture. So I think that's a really wonderful read because it suggests that one approach that she is a fan of and has talked about a lot, both in the book and in her work as a podcaster and health reporter, is what's called division of responsibility at the dinner table. So the idea is parents provide nutritious, tasty meals, including regular access to treats and desserts and so on. No food is forbidden, but you provide well-balanced meals, and then the child is fully responsible for what they eat of what's on offer at meal times and how much they eat of those foods that are offered. So what Virginia argues, and what many clinicians in this framework have argued, is that's a way of cultivating an atmosphere of autonomy and bodily self-trust at the dinner table. So there's structure, there's a framework, but that is a way to think about the family dinner table as a place for connection and a place for curiosity and low pressure around not having to finish a certain number of bites of broccoli to get the reward of a cookie, which is actually very clearly going to make the broccoli less appealing. So many studies show that if you make a child finish their vegetable soup before they can have dessert, they rate the vegetable soup as less tasty. So if we just present these foods somewhat neutrally, we don't have this categorization of good foods versus bad foods. There's just an attitude, here's dinner, and let's have a conversation. That can be a way of really taking the pressure off and cultivating this atmosphere of bodily autonomy and self-trust. So that's one piece of it. I also think it is valuable to have a lot of representation of body diversity of all kinds in the children's books that you read. So I'm a big fan of having just a very healthy, robust sense in a household that we all come in different shapes and sizes, different skin tones, different hair textures. Some of us use a wheelchair. Some of us may have limb differences or facial differences, and that is a normal, beautiful part of human diversity, and we are all equal. So a book like, just to name one example, Tyler Fetter's Bodies Are Cool, is just a beautiful exercise in representation and just looking at body diversity as valuable and interesting rather than trying to shut down conversations that might involve healthy curiosity about bodily differences between people. I think it's nice to say, oh, look, here's someone who has a prosthetic leg, or here's someone who's in a larger body, and our bodies are different from one another, and that is actually a cool thing, not something to hide from children. So that's certainly two pieces of it. And you can tell I've put a lot of thought into this topic, so I could go on and on. But those I think are really valuable starting points, as well as finally, I should say, to have a conversation that's ongoing about, just as I think white parents are responsible for introducing their child to the topic of racism and saying, look, we have to be conscious of white privilege, I think it's also really valuable to have conversations early on in an ongoing way about fat stigma and fat shaming, and really make it clear to children that no matter what our body size, we are all responsible for making it a just, kind, inclusive world. It is never okay to exclude someone based on her body size, and that's another important piece of it.
Thank you so much. I think those are, like you said, great starting points for parents. So something else I really appreciated about you tackling in the book is the relationship between fatness and health, because I think this is a real big stumbling block for many well-intentioned people too, and as you point out, medical professionals at times as well. So you say we must find a way to have a conversation that recognizes the complicated relationship between fatness and health, highlighting that fat bodies can be healthy without insisting that fat people must be healthy in order to be valid. And so I think this statement speaks to your point about how fat phobia and healthcare intersect in negative ways due to a stigma around fatness that we've been talking about. So I wanted to ask you this. Can you say a little bit more about this idea and about how you personally think about reframing that relationship between fatness and healthcare?
Yeah, I'd love to. So I think one thing to get out of the way right at the beginning is whatever you think about the relationship between fatness and health, let's be clear, everyone, regardless of her body size, deserves adequate health care and compassion and good treatment and kindness. So even if everyone rejects all of what I say in the book about this actually being a really complicated and interestingly complicated empirical picture, I think we can agree, or I hope we can agree, that fat shaming needs to end and weight stigma needs to end. And that's a piece of the book that is really important to me, is looking at the way weight stigma is actually really damaging the health of fat people. So study after study shows that in particular, people are getting inadequate health care when they're at a higher weight. So this isn't just implicit bias, this is explicit bias. Doctors who will actually tick the box on the form that says, for a fat patient, this patient is more likely to annoy me, this patient feels like a waste of my time, and this patient is someone who they will rush through an appointment and not spend as much time with. So this is really explicit bias that means that fat people are often not getting the health care that they deserve, and are also so subject to weight shaming at the doctor's office that they avoid seeking preventative care such as cancer screenings, which means that tragically we have people who are dying or at least suffering from really severe health problems because they feel too ashamed and too unhealthy to get the health care that they deserve access to. So that's a piece of it, that weight stigma, no matter what someone's weight, can be deadly. It can really prevent someone from getting adequate health care. And that, I think, deserves emphasis in this conversation. And I think another part of the conversation that is important draws on research by the award-winning CDC epidemiologist Catherine Flegel to show that, this is quite a complicated relationship between fatness and health. So the relationship between the two can be pictured as a U-shaped curve where people who are at the bottom part of the curve have the lowest mortality statistics in terms of how likely they are to suffer premature death. And that lowest point in the curve is actually for overweight people. People who are classified as overweight, according to the BMI charts, have the lowest mortality risk, statistically speaking. So despite the fact that people who are overweight are often told to lose weight, that is, in fact, statistically, again, the healthiest place of that U-shaped curve to be. And while we know that, I should say too, a piece of it is that people who are so-called normal weight and people who are even moderately obese, terms I don't love, but I'll use for the purposes of just framing this medical finding, they have the same statistical risk of mortality. So even being in the obese category with a BMI of between 30 and 35 is not associated with elevated health risks in general. Now, it is true that both very thin and very fat people are subject to greater health risks in terms of the correlation between being those weights that are on either end of the spectrum and having greater health risks. But there are important questions to be asked. Is that causation? Is someone's health problem caused by their weight? Or are they, for example, subject to so much weight stigma that they're suffering health problems because they're not getting adequate care? So I think it's still an open question whether weight of a very high kind is the cause of health problems. But again, even if the answer to that question turns out to be yes, people in that category still deserve to be treated like human beings.
Of course, yeah. That actually speaks to a couple more audience questions we have around this. So specifically around BMI. So from two different perspectives. So we have Carly's asking, I'd love to hear Dr. Manne's thoughts on the interplay between changing cultural norms, fat phobia specifically, and improvement of institutional fat phobia. And they say, I'm perpetually shocked by how BMI creates actual barriers to access, that's what you're speaking about, to healthcare, particularly for women, and when this will be seen as an equal access issue. So that's part one. And then we have a second question that's related from Allison, who was working in the medical field. Do you have any suggestions surrounding BMI and how to address this as a provider?
Yeah. So I think there are doctors, including Dr. Mara Gordon, who is a weight neutral and inclusive physician working in this space, who really don't see BMI as a particularly useful metric anymore. And one of the reasons for that is the BMI is based on ultimately the measurements of Adolphe Quetelet, who was a 19th century Belgian astronomer, and who made this assumption that the average body was the ideal body. And his average body was that of 19th century Belgian military men. So why we should be regarding that as the gold standard for human beings right now, there is no good answer to that question. These are, again, very arbitrary standards rooted in really a quite sordid and racist history that Aubrey Gordon has done brilliant work exposing. So I'd encourage people to look into that too. So I think it's possible to think about the BMI as a very unreliable proxy for things that can be measured directly, people's blood work, people's blood pressure, symptoms that they actually have. And I think there is an argument made by people who are working in this space that BMI isn't terribly useful. Now, of course, I'm not a doctor, I'm not a medical researcher, I'm not an epidemiologist, so that is a controversial view and something which I wouldn't regard myself as in any way the authority on, but it's just a point to the fact that there are people who are working in this space and thinking of themselves now as weight-neutral clinicians who will do things like, for example, not weighing a patient when they come into the doctor's office, because usually we don't need to know what someone's exact weight is in order to give them appropriate medical care. There are, of course, exceptions to that rule for the dosage of a medication, for example, or to assess a child's growth rate. So I'm not saying no one should ever be weighed, but there are certainly people who are pushing back against the idea that you need to be weighed the second you get to the doctor's office, even if you're there to seek, for example, treatment for a migraine, which is, according to most people, not associated with your BMI.
Right.
So that's part of it. In terms of the institutional connection here, I think that's really crucial. So in the book, what I talk about and the way that I try to frame this is that Fatphobia is really a straitjacket restricting people's movement, their freedom, their potential. So I think it has constraints for all of us who have a human body. It tells almost everyone not to get any fatter or else, but it tells in particular fat people that they don't fit the world, and it is a way of constraining us in ways that are literally physically painful and are also stigmatizing. So I wanted some of that imagery of the white straitjacket that is used to mark someone as undeserving of care. And we see this show up in so many institutional settings. We see it in healthcare, as I've adverted to. We see it in employment, where fat people, particularly fat women, are subject to really widespread discrimination. And we see it in education, where fat children are stereotyped as less able and less brilliant and less competent in ways that don't reflect their actual test scores or performance. So if a child gains weight, they will be perceived as less able, even though nothing has changed objectively about their test scores and performance. So those general results hold, but I think it's also really important to look at how vulnerable communities are affected by fat phobia that restricts their access to the medical system in ways that are especially pernicious. So, for example, for trans patients who seek gender-affirming care, large studies at Mount Sinai in New York have shown that a large portion of those patients are denied gender-affirming care on the basis of their BMIs, even though there's often a lack of evidence or even hard evidence against the proposition that it would be risky to operate on someone with a higher BMI. So, for example, top surgery for someone who is seeking gender-affirming care as a trans man has been recently shown not to be more risky for patients who are of a heavier weight. And yet there's a lot of gatekeeping of that really life-saving gender-affirming care, which can protect people from a huge risk of mental health issues and even suicide because they happen to be a fat trans person. So yeah, I really think it is an issue of equity and access, and we see some of the hypocrisy of those policies in the fact that often those fat patients would be allowed to have weight loss surgery, but they're not allowed to have gender-affirming care or knee surgery or whatever else it is. So there are no reasons why we shouldn't be treating people with the bodies that they have rather than requiring them to do something which is often just not on the cards for a particular patient, given how difficult weight loss is for many people.
Thank you for that. We have some questions coming in around A1C blood test indicators. Would this be something you could speak to?
I'll try my best. Again, not a doctor,
right?
Not that kind of
but
doctor.
Your perspective, I think the audience is interested in your perspective on this because you've obviously thought about, this subject a lot. So some questions are, there's a push to lower the A1C in moderately overweight patients. At what point should we draw the line?
Yeah.
And then just more generally, if you have other thoughts on this kind of push around these indicators.
Yeah, so this is interesting because this overlaps at least with an area of care for patients with so-called pre-diabetes that is rather controversial. And again, I certainly don't regard myself as the authority in this space, but psychologists and endocrinologists who are working in a weight-inclusive and weight-neutral paradigm have been critical of the diagnosis of prediabetes on the grounds that fewer than 2% of people diagnosed with prediabetes actually go on to develop diabetes annually. So there is a worry that we're setting the threshold for what someone's blood sugar levels should be, and A1C, for those of you who don't know, is a measure of the history of someone's blood glucose levels over a several-month period. There's a worry that there's something a bit too alarmist about setting the standards where they currently are, and that people are assuming they're headed on a surefire course towards being a type 2 diabetic, when in fact the risk is still rather low. So that's certainly a debate that's playing out in this space. And yeah, regardless of what the outcome is, I do think we see a long history of the expansion of certain categories of medical diagnosis, which is in part pushed by drug companies who are ultimately profiteering in this space. Certainly we see the push to consider obesity, so-called obesity, just fatness in itself, a disease, was arguably partly the result of the advent of new weight loss drugs that were coming to market, and drug companies were really hopeful that they would get more health insurance coverage if you could define obesity as in and of itself a disease rather than an unreliable proxy for disease risk factors. And this kind of expansion is really not unique to this area. We see it in so-called condition branding for things like hyposexual desire disorder for women. So as soon as you have a treatment for women's supposedly low libido, that becomes a medical disorder rather than a normal human variation where some people might be on the asexual spectrum or on it at a certain point in life. We also see things like testosterone deficiency becoming this huge boom in diagnoses because because drug companies had testosterone treatments that they were pushing. We see this too in the history of human growth hormone. When that came to be available, idiopathic short stature became a medical diagnosis, which just means being short for no particular reason. So again, we have to be a little bit careful about the way this isn't about entirely neutral and well-meaning attempts to regulate people's health and help them live the best, happiest, healthiest lives we can. It's often partly about what's profitable for drug companies that have something to sell. And if they brand a medical condition like prediabetes, then the treatments they have available for those conditions will be more marketable. So that's certainly a factor to at least keep in the back of our minds as a process historically and culturally that we should be worried about in this space.
Oh, thank you. Before we move on to kind of our final question, we have one more that kind of loops us back to what we were talking about regarding within the healthcare and within the healthcare field, but particularly around children. Katie, is interested to hear your thoughts on how to successfully navigate the medical system as a parent of an overweight child. They say they've consistently run into bias, even though she's a registered RD. And so what thoughts do you have for maybe educating those who care for our children regarding size inclusivity?
Yeah, that's such a great question. And Katie, I'm so sorry you're dealing with that. That really resonates as a problem that many parents face. I think that one very practical strategy that some people have practiced and that I think is useful is to talk to a doctor or nurse practitioner or provider of any kind before the child is in the room for the consultation and say, we are a weight inclusive or body neutral or whatever term you want to use, family, and a direct discussion of my child's weight is something that I regard based on the evidence as putting her at higher risk for eating disorders. By the way, a lot of research shows that the triggering event for a child developing disordered eating was a visit to the doctor and a patronizing conversation about their weight. A lot of people who are larger can tell you about that experience as having been formative in their feeling their bodies were just wrong. So to go into a physician's office and say, look, I don't want you to mention anything about the child's weight. We can talk about exercise. We can talk about nutrition. Although if she's an RD, then there is no need to add that piece of it to the conversation. But we can talk about health stuff that is something that we can practice as a family in terms of healthy behaviors, but we don't need to control, analyze, and scrutinize a child's weight directly. So that's, I think, a useful piece of education to just say, this is what we require as a family to take weight as a piece of it out of the conversation. But I also think that books like Fat Talk are really excellent to share with physicians who are interested in practicing something which would be more inclusive to children in a variety of body sizes. So, it has a lot of interviews with pediatricians, with doctors, and with parents of larger children that I think make it very clear how stigmatizing those, again, well-meaning conversations about a child's weight can really be.
Wonderful. Thank you. So before we go, towards the end of the book, you develop a new approach or perspective that you call body reflexivity. So I wanted to ask you, what do you mean by body reflexivity, and how is it different, or how does it fit in between body positivity or body neutrality?
Yeah, thank you. I found myself, because of course, part of what I'm doing in this book is navigating my journey with my own body. And the thought that helped me the most in navigating it was the thought that my body is for me. Your body is for you, and likewise for any person listening. So there was this sense that I had that body positivity was not terribly useful to me. I don't think that maintaining a monolithically positive attitude towards our own bodies is particularly realistic in such a fatphobic society. I mean, good for someone if they manage it, but there's an element of the advice that feels a little bit like toxic positivity. You must be positive or else. It feels a bit too prescriptive. And by the same token, body neutrality feels a little bit lackluster. Like, even maintaining a purely neutral attitude about our own bodies feels both a bit dispiriting and also very hard to achieve in the society we actually have. So I began to think, well, why are we assessing and to some extent comparing bodies at all? Why are we saying, well, we need to award our bodies like a positive number or a neutral number like a 0 instead of a negative number? We should be just throwing out the whole scale and not assessing bodies whatsoever. So the idea of body reflexivity, the idea that my body is for me, is really meant to make good on that idea that our bodies are not something for assessment or consumption or correction or colonization. Rather, everyone's body is for them and no one else, and her perspective on her own body will be variable, and it's the only one that matters. So I find that my self-criticisms and insecurities are not completely resolved, but really fall away when I reflect that my body is my home. It's what I have to work with. It has helped me love and grow and nurture and think and move and breathe in a world that is often hostile to people in larger bodies. So instead of thinking about ways in which my body could be improved, the idea that my body is for me has allowed me to think of my body as something which has weathered a lot of storms and for which I'm ultimately incredibly grateful.
Well, Kate Manne, thank you so much. Thank you for being with us. Thank you for this book. And audience, thank you so much for your questions. And we'll see you next time on Keynotes.
Thank you for this great conversation, Amanda. And thank you all for being here.